Good afternoon. I'm Velshi. New York City hospitals are overwhelmed by a skyrocketing number of coronavirus cases. They're finally getting some much-needed help. The U.S. Navy hospital ship, USNS Comfort, is now docked on the west side of the city, where the ship's medical personnel will take care of patients with other medical issues, not coronavirus. New York City Mayor Bill de Blasio described how he felt as he watched the ship dock this morning.
It's a very emotional moment. I went up on the roof here to watch the Comfort come in, and I had this incredible feeling of peace, actually, that help was finally coming, that we were not alone.
The Comfort's arrival comes as the field hospital set up in New York City's Javits Center is also about to open, along with another field hospital in New York Central Park. Nationwide, there are now more than 153,000 confirmed cases of the coronavirus. More than 2,800 people have died in the United States. We should note that most people who contract the virus will recover at home without ever being hospitalized. While there are a huge number of cases in New York City, other big cities, including New Orleans, Chicago, and Detroit, also grappling with a rising number of cases, something that is worrying to the head of the White House Coronavirus Task Force.
We're very worried about every city in the United States and the potential for this virus to get out of control. If we do things together well, almost perfectly, we could get in the range of 100,000 to 200,000 fatalities.
If we do everything well, we could get in the range to 1 to 200,000 fatalities. These concerns have led President Trump to extend his administration's social distancing guidelines until at least April 30th. You'll recall he was talking about Easter, April 12th. But there's evidence that strict containment strategies enacted by Washington State during the early days of the outbreak may have paid off, at least right now. According to the New York Times, researchers say that deaths are not rising as fast. Hospitals have not been overwhelmed so far, and the spread of the virus in the Seattle area appears to be slowing. All right, we're going to begin with the arrival of the USNS Comfort in New York City. My colleague, Rahima Ellis, is near Pier 90 in New York City, where the ship is docked now. Rahima, I remember in the days after 9/11 when that ship came into New York and the way it sort of lived up to its name, the Comfort. This is a massive ship, and it comes sort of representing the idea that the U.S. military is in on this to help Americans.
Without a doubt, it really is a dramatic show of support for people here in New York. It is kind of stunning to see this magnificent ship, as you pointed out, Allie, with the two red crosses there at the bow of the ship, and giving people some hope that there might be the kind of assistance that they need. You point out this is a 1,000-bed facility for non-COVID-19 cases. The Javits Center is opening up to assist as an emergency field hospital to ease the burden. Also, the hospital that's being set up, the field hospital in Central Park, of all places. But some are still wondering, is New York now at the point that it has everything it needs? But remember, last week we were talking about the mayor saying that they needed 140,000 beds and they only had 53,000. Listen to what New York City Mayor Bill de Blasio said earlier today.
My message to the president is thank you, and we need more help. And that's not because any of us likes to have to say that, but because it's true. The toughest weeks are ahead. We are bracing ourselves for something we've never seen before in any of our lives. And the federal government, in many ways, is the only force that can help us to reach the level of preparation we need to save every life we can save. So I'm going to keep calling the president. I'm going to keep appealing to him to get us all the help we need for these really tough weeks.
One of the things that de Blasio was pointing out that Governor Cuomo was saying earlier today was that people do have to remember the numbers. And as the mayor was saying, when they reach their peak, which they think will come in a couple of weeks, they want to be prepared for it. There had been some questions asked, Ali, as to whether or not New York did have all that it needed, because there's some questions of whether or not supplies were being hoarded. The governor addressed that today, saying, yes, we are stockpiling supplies because New York wants to be ready when the call comes out that there is a need, he said the time to shore up your supplies is not at that very moment where people are crying out for assistance. He said that's not how you win a war. You win a war by stockpiling and being prepared for it. And when you look at the numbers, the governor said it is a reason for them to be concerned. So far, he says in New York State alone, there have been more than 66,000 cases that have tested positive for COVID-19. And while the rate of escalation is slowing down, he says they are still seeing the numbers going up, and they want to be ready when they need to. Ali?
Rahima, thank you. Rahima Ellis on the west side of Manhattan with the U.S. naval ship Comfort. Let's listen in. California Governor Gavin Newsom has started his briefing. Let's listen into what he's got to say.
Support of the federal government, these field medical stations. We already have our Santa Clara operation up and running. We have Riverside up and running. We have work being done in Los Angeles and San Mateo that will share some of that surge in San Francisco, part of the FMS process, again, already operationalized. Seton Hospital already operationalized that we brought into the portfolio of assets here in the state. We've been talking over the weekend to get St. Vincent, 366 beds in Los Angeles, fully staffed up as well. And we'll have some specific announcements on that in the next few days. Community Hospital down in Long Beach, we're starting to see that all take shape in real time. We have other hospitals we've identified in addition to the FMS sites in the USNS Mercy. We are also looking to get some 1,000 skilled nursing facility units up and running, and we have indeed made real progress in other areas from Fairview and Porterville, and now working with the Army Corps of Engineers that has now looked at 15 high-priority sites. They have got 4 more that they'll be looking at, from the Sleep Train Center here in Sacramento to Oakland Coliseum to the LA Coliseum and other sites throughout the state of California, looking at those sites as potential surge sites, all part of the plan to increase by 50,000 beds our available capacity within our healthcare delivery system. We have distributed now some 32.6 million N95 masks in the state of California. We have our sights on getting that 101 million that we have locked up into the state. And every couple days, more of that PPE comes in, not just N95 masks, but coveralls and shields and gowns and gloves, glove sets and the like. And so as soon as we get them in, we get them out. Yesterday, we were getting in a number of ventilators into Bloom Energy for refurbishing and reconfiguration. I'm very pleased the 150 that came from LA as part of the national stockpile, all of those have been completed and are done and are being sent back out into LA County. And I just want to encourage folks, if you have a line on ventilators, it doesn't matter if they're brand new. Maybe you have a few pieces lying around your basement or the house. I don't mean to be flippant, we'll take them. We've got the folks here in Silicon Valley that can do miracles with old equipment and refurbish that equipment. I just mentioned a few days ago that our community college system, they found 192 ventilators, not all of them in perfect shape, some of them used for training and the like, but we'll take whatever we can get. We currently have 4,252 ventilators that we've locked down. Our goal is to get to 10,000 ventilators. We're looking to procure new ones from around the globe, and we're hopeful that the federal government can assist us beyond the 170 that came into LA County, but if they don't, we'll be as resourceful as we possibly can. So on the physical asset side, that surge of 50,000 beds, we're making real progress. On PPE and lining up and identifying those needs, we're making progress, but still more needs to be done. But as it relates to personnel and people, nothing more valuable and nothing more potent to meet this moment. And so if you're a nursing school student, a medical school student, we need you. If you've just retired in the last few years, we need you. If you are looking to expand your scope of practice and have particular expertise in any particular capacity, we need you, and we encourage you to take a look at that health core.
All right, California Governor Gavin Newsom echoing a plea that has been made by other governors, including New York Mayor Cuomo, about the idea that if you are a retired healthcare practitioner or you've got some expertise in healthcare, but you're not working in the field, come on in. We need you. Today, Cuomo actually asked nurses from other places to come to New York to help with the logjam in treatment of coronavirus here in New York. We'll continue to monitor Gavin Newsom's press conference and bring you the news as it becomes available. Let's talk about the widespread economic impact. Millions of people are likely to have already lost their jobs as a result of the coronavirus pandemic. The worst of the damage is probably still yet to come. Economists with the Federal Reserve Bank of St. Louis estimate that up to 47 million Americans could lose their jobs, which would translate into an unemployment rate of 32.1%. Now, this comes just days after the Labor Department reported that nearly 3.3 million people filed first-time unemployment claims during the week of March 15th to 21st. Joining me now for a closer look at this is Austin Goolsbee. He chaired the Council of Economic Advisors under the Obama administration. He's also a professor of economics at the University of Chicago's Booth School of Business. And Austin, next Friday, or this coming Friday, is when we get the unemployment numbers for March. But the way the unemployment numbers are calculated means that it was based on a survey that was taken in early to mid-March, which means you're not going to see even the full reaction on Friday. It'll be a month before we see a massive surge in the unemployment numbers.
Yeah, you're absolutely right. It's still going to not look great, most likely, because the economy was slowing down. You had people on their own that were social distancing even before the orders came in. But in the months to follow, it's going to be horrible. They're going to be the worst numbers that we've ever had. I mean, the weekly unemployment claims were 5 times bigger than any week that we've ever had in the history of the country. That's to be expected. You know, as we've been saying all along, much of the American economy is driven by these service sector industries, which are exactly the things that shut down when you go into this kind of lockdown phase. And so the number one rule of virus economics is you got to get a handle on the spread of the virus before you can do anything about economics. So we've got to slow the spread of that virus. And only once we do that will we be able to come back. And hopefully this came on suddenly and could go away suddenly if we did get a handle on the spread of the virus.
So let's talk about this. Because it's not structural, does it all bounce back, or that depends on how this virus goes away, right? If we really break this curve and ultimately end up with fewer and fewer cases of coronavirus, people can go back out. But if it stretches out too long, what's the difference in how the economy bounces back?
I think there are a couple of big differences. The first is you have seen some countries like Korea where by extensively testing their population, they have been able to have only the people who are infected with the virus. Those are the only people who have to isolate. And so their economy has not gone down near as much. They're not in lockdown. They don't have the same economic problems. So that's why most economists are heavily pushing for let's get more testing. Let's test for antibodies. Let's test for people who've already had it and they didn't know so they could go back out in the economy. If we don't do that, then I think we've got to slow the rate of spread of the virus, and how long it takes to do that will determine how fast the economy can come back. If we fiddle around and this extends for a long enough period that businesses go bankrupt, that people lose their jobs and can't go back to the same job that they had before, that we do permanent damage from what we hope to be a temporary shock, then the legs of the recession will be a lot longer. And it could even morph into a financial crisis type problem, because if the companies collapse and they can't pay back the banks, and then if the banks don't have capital and they have all these non-performing loans, then we're kind of back into financial crisis territory. So the Fed for sure is trying to prevent that from happening, and we just got to get a handle on this virus. And if we do that, as long as it's short-lived, we could go back to if not where we were before it all started, certainly a place that's a lot better than where we are right now.
Austin, thank you. Thank you. And you talked about antibody testing. I'm going to have that conversation just next. Austin Goolsbee. Groundbreaking new coronavirus testing could soon provide the first wave of workers who can return to their jobs. Now, this is not a test for whether you've got coronavirus. It's whether you've had it. According to Stat News, which delivers updates into the world of science and medicine, this antibody test will, quote, pinpoint people who are immune and reveal the full scope of the pandemic. The test could properly identify which individuals may have already battled coronavirus, the people who couldn't get a test, people who were sick but got better on their own, or people who didn't experience any symptoms at all. The piece goes on to say, quote, the test could signal who could be prioritized to return to work or serve as a frontline health worker. Joining me now is Stan Bergman. He's the CEO of Henry Schein, which is a major distributor of healthcare products in the United States and abroad. Henry Schein has just announced the availability of a COVID-19 point-of-care antibody rapid test. Stanley, thanks for joining me again. You and I spoke on the weekend when you first had this news. How quickly can this test be conducted? And I guess what's really important to my viewers is how quickly will it get out to doctors' offices and medical centers and hospitals and I don't know what else, drugstores, where people can have this test taken to find out if they had coronavirus and whether they've developed an immunity to it?
Good afternoon, Ali. You know that Henry Schein is the largest provider of products to office-based healthcare practitioners. That's dentists and physicians in their private practice. Some of those practices are owned by large hospitals. I just want to clarify, I'm not a physician, and number one. And number two, I'm so glad that the other day you gave me an opportunity to express the fact that testing is quite complex. It's not like a pregnancy test. There's no simple answer. There really are these three kinds of tests. There's the PCR test, which is at the early stage and can identify the coronavirus. There is the antigen test, comes a little later. And then there is the antibody test, which is the one that we announced will be brought to market in the United States shortly. And the test, which is a blood test, it's available, will be available later in this week or early next week, and should be in a position to test eventually millions of Americans to determine whether the patient has been exposed to the virus. This has to be read by a physician, in our view, a physician that is taking into account the patient's history, other tests, and the symptoms.
And Stan, how quickly can this be ramped up and distributed? How widely will it be distributed? You did mention it's a pinprick blood test, but it needs to be administered by a health professional. Tell me how that all works out. How quickly? Because people are going to be saying, hey, maybe I felt like I had the symptoms of this thing a week ago. Maybe I can go back to work.
Well, it can be administered by a healthcare professional, even a paraprofessional, but should be interpreted by a physician, ideally, in conjunction with understanding the patient's history, previous tests, and symptoms. The tests are likely to be available in hundreds of thousands next week, late this week maybe, and in millions thereafter.
Stanley, thank you for joining us on this. Stanley Bergman is the CEO of Henry Schein, and they have a test coming out that can determine whether you have antibodies to coronavirus. Just last hour, we heard from former Vice President and 2020 Democratic contender Joe Biden. He joined my colleague Yasmin Vasugian and defended his opposition to a single-payer health care system in light of the coronavirus pandemic.
The thing that is needed is, for example, we have a whole number of hospitals that are being so stretched, including rural hospitals, they're going to need more financing. That doesn't come from a single payer system. That comes from the federal government stepping up and dealing with the concerns that they have, the reimbursement that they're going to get, how they're going to be able to move forward, and how they're going to be able to provide all the needed help that are needed in their communities. This is an opportunity to look at reconstructing the healthcare system in a way that, in fact, can respond more rapidly and more effectively to these kinds of crises, because it's going to come again.
The former vice president went on to emphasize the need for scientists and experts to, quote, run the show as the nation grapples with the crisis. Now, the U.S. federal prison system is starting to feel the impact of coronavirus. Over the weekend, the first inmate at a federal prison in Louisiana died after contracting COVID-19. According to the Federal Bureau of Prisons, right now 19 inmates and 19 staff have tested positive for the virus across 122 facilities around the country. A number of former DOJ leaders, attorneys, and judges sent a letter to President Trump urging him to release vulnerable inmates from federal custody. Officials say the overcrowded facilities and cells will cause the virus to spread rapidly inside detention centers among inmates and staff, which will then spread into the surrounding communities. Joining me now is Philadelphia District Attorney Larry Krasner, who was, I saw talking to Chris Hayes about this last week. And Larry, I just thought this is a really important conversation. I want to know what you have taken it upon yourself to do and what you think others should about when it comes to incarcerated people who are exposed to this infection.
So thanks for having me, Ali. You know, the most important thing to understand is that it really doesn't matter whether we're talking about billionaires at a cocktail party or we're talking about broke people in jail. The bottom line is the spread of this virus among any group of people affects every group of people. And so this is not just about the lives of the inmates, the corrections officers, people who work in those facilities, people who may visit there, all of which matter. This is about stopping what we have now, which is we are the most incarcerated country in the world, and we have jails and prisons everywhere. They are essentially giant cruise liners where any outbreak can spread extremely quickly, and when it does, it will inevitably affect the rest of the population.
And of course, for all the pronouncements that governors and mayors make about social distancing, in prisons, people don't have those choices.
They don't have those choices. So the kinds of things that we have to do here are to understand that at a moment when courts are closed all over the country, we have to somehow have a pathway to get people out of jail and to stop the possibility of just building up these populations higher, because it's not as if arrests are stopping. There are some smart policies around the country to only arrest for serious stuff right now and to arrest for the less serious stuff later, like what is happening in Philly, and our police commissioner has done a good job with that. But we have to watch both the entrance door and the exit door to these jails, and that's why, you know, we see in certain jurisdictions that the whole system has worked together as a team, and they've had tremendous success in lowering the population for people who don't need to be in jail, for example, in L.A.
Talk to me, yeah, I was going to say, give me some examples of what you think is working and how it's working, because there are a whole bunch of people who say, hey, look, this isn't a partisan matter at this point. We certainly don't want to have petri dishes for coronavirus. At the same time, how do we do this in a constructive way that doesn't end up, you know, with the wrong thing happening, with the wrong people being let out into society?
So it's extremely important that we're careful about what we do. Nobody is saying let Charles Manson go home. Nobody is saying we're not going to arrest people for rape cases and shooting cases and homicide cases. Of course we are, and we're going to put them in jail right away, and we're going to seek very high bail in those kinds of cases. But we're talking about everybody else. Let us remember, this is the most incarcerated country in the world. We've had a 500% increase in jail population in the last 30 years. Some places are even worse. Pennsylvania has had an 800% increase, and Philadelphia has had absurd rates of incarceration at different times, although it's getting better now. So we look at the jurisdictions that are doing well, and what they're doing is they are finding ways to take whole categories of people who have offenses that are not that serious, whose histories are not that serious, and they're getting them out without going through this process of doing hearings one by one and doing a lot of stuff on paper. Unfortunately, right now in Philly, we're getting bogged down with the courts requiring us to do individual written filings, case after case, and in 2 weeks, we've only seen a reduction of 200 people. It's less than 5%. But if you look at Los Angeles, which is a much bigger jurisdiction, they got 1,700 people out of jail in the first week, and in the second week, they're moving towards as many as 2,000 more. They may be looking at a 20% reduction in jail population in the biggest criminal justice jurisdiction in the United States. So they're doing something right, and they're not the only place that's doing it right. We're gaining momentum here in Philly, but we just haven't got there yet.
Yeah. Larry, thanks for joining me. Larry Krasner is the district attorney in Philadelphia with yet another issue that isn't front of mind for everybody that coronavirus is making us think a lot about. We do have the largest incarcerated population in the world. We learned a short time ago that another member of Congress may have contracted coronavirus. New York Democratic Congresswoman Nydia Velshi tweeted this afternoon that she was diagnosed with a presumed case. She says her symptoms were mild and that she's isolating herself at home. Velshi was in Washington on Friday. She spoke on the House floor during the debate on the coronavirus relief package and took part in the ceremony afterward with congressional leaders. While the nation's been fixated on New York, where I am, as the epicenter of the coronavirus pandemic, the Midwest is bracing for its own dramatic surge of cases. Cities like Detroit, for example, are already feeling the brunt of the virus. At this time, there are more than 1,800 cases of coronavirus in Detroit alone, and that's taking a major toll on public services. As of now, more than 1/5 of the city's police force is quarantined. This comes after 2 officers died from coronavirus and dozens more have tested positive, including the chief. Joining me now is NBC's Morgan Radford, live from Detroit. She's right outside the Henry Ford Hospital, where doctors could soon face a devastating task, deciding who receives life-saving treatment if those resources become even more scarce. Morgan, tell us how healthcare workers are preparing for the surge of patients where you are.
Right now, Allie, frankly, they're preparing as best they can because, as we heard from the governor in an earlier press conference today, the state has already seen over 5,000 cases, now making it the 4th largest total number of cases in the entire country. And those are the types of decisions that you mentioned just in your introduction that they're facing here at Henry Ford Hospital. They're treating about 1/3 of the coronavirus patients in the city of Detroit, and that's about 200 to now 300 coronavirus patients inside that building behind me. And the reality of it is, when we spoke to the chief operating officer yesterday, he said, we have enough supplies today, but the question is about tomorrow. They're not clear how many supplies they're going to receive and what they'll be able to use. Over the weekend, the governor did acknowledge that she received over 100,000 N95 face masks. So that's what a lot of the healthcare workers are wearing inside. But as per that memo, Allie, that was really heart-wrenching just to read. They were effectively creating a memo that they would have to put into place, standards they would have to put into place if, in fact, they have even fewer resources than they do now. And that memo said things like, basically, they were going to have to give their life-saving treatment to people who had a better chance of surviving. So imagine you're someone who's dealing with an elderly patient, an elderly family member who's going inside that hospital, and you understand that that's what that decision could come to. Those are the type of decisions they're facing here on the ground. But what's interesting about this place, Allie, is that Motor City is phenomenal. They are using their manufacturing power to come to the rescue of health workers like the people who are inside. Entire auto factories have now been transformed, and they're producing medical supplies to try to create this sort of stopgap. So in the midst of this harrowing, uncertain time where people are just walking up and down the street with their face masks, with their gloves, trying to stay as protected as they can, you're also seeing moments like this community coming together. Allie?
Morgan, thank you, my friend. And I just want to apologize to our viewers. For some reason, we had video of the former Attorney General, Jeh Johnson, when I was talking about Detroit. The two have nothing to do with each other. But these are strange times because we're all trying to put these TV shows remotely, so accidents happen. We do apologize. That Jeh Johnson has been on our air a good deal talking about Homeland Security Secretary. I'm sorry, I said Attorney General. He was the Homeland Security Secretary. He has been on our air a whole lot, and we apologize for that. I want to bring in Dr. David Shulkin. He's a physician and the former U.S. Secretary of Veteran Affairs under President Obama. Just waiting to see. Yeah, that is actually the right guy. That is David Shulkin. David, you were the head of the VA. You have led 2 major hospital systems, including one here in New York City. I just want you to conceptually help us understand this, because it sounds very frightening that doctors are making decisions about who lives and who dies. Tell me more about how we deal with the rationing of supplies when we have a surge of critical patients in a hospital.
Allie, I think you're correct. For many Americans, hearing about this issue is a big shock. There is no tougher decision in medicine than to have to choose between patients when you have scarce resources. And for many, this dilemma is probably something that they can't believe that we're facing in this country. But we have faced this, and we face this on a regular basis with organ transplantation and having to decide which patients get the organs first. So I think that the principle that you want to do here is it's about saving lives. You want the resources to go to those who are going to benefit from them the most, and you want them to do the most good. And the way that you need to make these decisions is actually do it beforehand. You never want to put a bedside doctor or nurse in the position of having to choose for their patient. So thinking about these ahead of time and where the resources are going to be used best in a scarce situation is extremely important to do.
Is this a problem across the board, or is this a problem that has to do with the shortage of ventilators in this country right now, or is it the shortage of staff in places like New York, where you heard the governor calling for medical workers? The military's done the same thing, called for people with medical training. What are we dealing with here? Because generally speaking, I know you've cited a few examples of where medical professionals have to make this decision, but generally speaking, we don't have to.
Yeah, this is something that people in healthcare, particularly those who run healthcare systems, have thought about a long time. And many had policies that they put in place back in the H1N1 crisis around 2009, 2010. But now we're facing a new uncharted territory. So while people are talking about ventilators and protective equipment right now, we may be facing this when new treatments come out for COVID. We may be facing this with vaccines who come out, and they're not going to be in vast supply all at once. We're certainly facing it with staffing shortages that frankly could get worse as more healthcare workers themselves get infected or have to stay at home to care for those that are. So I think that it's really important that we think about these issues now, and hospitals like Henry Ford that are putting out those ideas and policies, I think it would be irresponsible not to be doing that. It's more important to be transparent, open, fair, and respectful about the way that you allocate resources than to do it in a way where people think that this may be gained. And we certainly should never be in a position where those that can afford it are the ones who get the services first. That would be a bad public policy. And so being open and transparent about how we think about these issues to benefit the most people is vitally important for us at this time.
David, I think it might have been over a month ago that you and I first talked about coronavirus, and you talked about the VA having facilities that it could open up to others. We're now starting to see that happen. In addition to field hospitals in New York at the Javits Center and in Central Park, we've got VA facilities saying that they are going to open their facilities to people who are not veterans because they do have the capacity for the moment.
Yeah, it's the right thing to do, and I'm so pleased to see that VA is reaching out to make that available. In New York, they've offered 50 beds for patients, and I think that they have 3 facilities in the New York City region. This is something that they train for. VA has over 13,000 beds across the country and 325,000 health people who work in their system. So this is something that I think that VA is going to be an important national resource as we respond to this pandemic in this country. And we're just beginning to see that happen now.
Dr. David Shulkin, thank you for joining me, sir. David Shulkin is a former secretary of the Department of Veterans Affairs and the former CEO of a couple of very large hospital systems. He's been helping us all along to understand this. Thank you, David. Social distancing is protecting us from the spread of coronavirus, but for Americans in abusive relationships, it could increase the danger they face. Officials say domestic violence cases are likely to increase due to the pandemic. According to the Centers for Disease Control and Prevention, 1 in 4 women and 1 in 7 men have experienced severe physical violence from an intimate partner. So what do you do if you or a loved one find yourself trapped in your home, or maybe you're trapped with an abuser? I'm joined now by Crystal Justice, the Chief Marketing and Development Officer for the National Domestic Violence Hotline. Crystal, thanks for joining us. Tell me about the circumstances you've heard of in which this situation of domestic violence is made worse because of the pandemic, because of the idea that people are at home.
Well, hi, Allie. Thank you so much for having me on today to talk about this important subject. So we know any situation that adds stress or financial strain can have an impact on survivors, particularly that the frequency and severity of their abuse can increase. We also know that the added layer of having to shelter in place with your abuser on a national scale like this is unprecedented. And so, as you can imagine, the typical go-tos that survivors have for their safety plans are drastically different now that they're sheltering in place with their abuser.
Right. The typical go-tos are friends, family, and shelters. Obviously, they all now present new difficulties, right? Asking a friend or your family to take you in when they might have been sheltering in place and not exposing themselves. And then what's the situation with homeless shelters? Has anything changed? Are they still able to accept people? Not homeless shelters, but abuse shelters.
Sure. So, Allie, yeah, there are still many shelters and support services that are operational across the country. They're doing their very best to serve survivors during this time. But unfortunately, some of them have already had to decrease their services or suspend services altogether. And so what that looks like for survivors is, how do you shelter in place? How do you keep your safety during that time? And so that might look like physical distance in the home between you and your abuser when there's an abusive situation. It might also mean things that are virtual. So instead of going to stay with family or friends, potentially setting up a systematic contact. So a phone call or a video chat every day or every other day. And if you don't show up for it, your family and friends know that there's something drastically wrong and you've advised them what steps to take on your behalf. It also might look like proactively reaching out to the shelters in your area if you're considering shelter, and just keeping tabs on who's still open and who's still accepting intakes.
Crystal, I want to put up on the screen the National Domestic Violence Hotline. The number there, I'm going to say it for people who are listening to this on the radio, 1-800-799-SAFE, 1-800-799-SAFE. You can text LOVE-IS, or you can go to the hotline.org. Crystal, one thing that we have seen throughout the pandemic is how fantastic people are. And my viewers are going to want to know, what can they do? What can they do if they aren't professionals, but maybe they want to help someone who's the victim of domestic violence? What can you recommend that just average people who have no connection to this particular industry can do?
Yeah, well, first of all, if you know and care for someone who is a survivor, proactively reach out to them. See if you can be part of their safety plan. See if you could set something in place where if they text you a certain message, you know they're in trouble and you know how they want to be assisted in that time. We also help friends and family members here at the hotline. So it's not just those directly affected by the abuse, but we're here to strategize with mothers, sisters, and friends to help them.
Thank you, Crystal. Thank you for the work that you do, and thank you for the work that all people who are out there helping domestic abuse victims do every single day. And to those of you who are suffering from domestic abuse, or those of you who know someone who is, please remember these numbers. I'll tweet them out as well. The IRS is preparing to send out billions of dollars in direct payments to Americans. The administration says the payments will start going out in 3 weeks, but there are plenty of questions about who gets the cash. NBC News senior business reporter Ben Popkin has been trying to answer some of the questions. He joins us now. Ben, we don't have enough time for a lot of these, so I just want to remind people, keep sending us the tweets. I'm going to ask them to keep on using Velshi as the hashtag. We were just talking about victims of domestic abuse. I want to ask you about other people who are living on the fringes of society right now, including the homeless. Are they eligible for the $1,200 payment?
Most adult Americans who are within the income levels qualify for one of these payments. Now, the question for homeless people, of course, or those living in shelters, is what do you use as the address? How is the IRS going to find you? So experts tell us in those cases, you should contact your shelter or a relief agency that you're working with. Ask them, can you use their business address as your address for filing the tax purposes? Now, if you also need help filling out your form, your tax form, so that the IRS knows where to find you, you should contact a local community group. There are various free or low-cost services that will help those in need fill out their tax forms. But it's really important for everyone who hasn't filled out their 2018 or 2019 taxes, no matter if you're living in a house or living in a shelter or on the street, to send those in so that the IRS knows where to find you and give you your money.
Talk to me about people who are freelancers or gig workers who don't get a normal paycheck every 2 weeks.
Right. Well, every adult American with a valid Social Security number who is below that income phase-out threshold qualifies for one of these payments. So it's just important to file your taxes and to make sure that the IRS has your information. But you do qualify. And I understand the anxiety. We got so many questions. I guess people are just used to being cut out of payments or cut out of relief. People said, do veterans qualify? Do people on Social Security qualify? What if I already get these benefits? You, by and large, you qualify. So go ahead and make sure the IRS knows where to find you, and go to irs.gov/coronavirus, where they'll be updating with the latest information.
Ben, you and I are going to keep on doing this. Tweet Ben Popkin, tweet me, use hashtag Velshi. That wraps up the hour for me. I'm going to see you right back here tomorrow at 3 p.m. Eastern. Thanks for watching. Deadline White House begins right after this quick break.